When we talk about South Africa's just transition, we often think about coal, Eskom, and renewables. But what if we started somewhere else? What if we asked, what does justice really look like? My name is Tasneem Essop, and this is Just Access, The Real Transition, a podcast from PARI, the Public Affairs Research Institute. Over 10 episodes, we explore how the transition to a greener economy must begin with access to land and water, to power, decisions, and opportunity. Because if we do not change who gets included, really included, we risk building a new world that looks a lot like the old one. Water and electricity are central to our constitutional rights. Electricity is not just about lights. Water is not just about hygiene. These are the foundations of dignity, health, and safety, and the keys to a higher development pathway for society. In South Africa, millions of households are technically connected to these services, but for many, the cost is too high to use them consistently, or sometimes at all. Even worse, these costs have often been prioritized over other necessities, like basic nutrition. This episode begins a two-part conversation focused on access and affordability, looking at why so many South Africans are included on paper but excluded in practice. And we ask, what would it take to build a system where basic services are actually affordable and reliably accessible to those who need them most? We ask economist and researcher Dr. Tracy Ledger, who leads the Just Transition program at PARI, what real access means, and why inclusion on paper can still mean exclusion in practice. Okay, Tracy, why does access to basic services matter in the context of the just transition?
Well, the just transition is supposed to be about achieving equity in the climate transition. I mean, we need to remember that the climate transition is more than just the energy transition. It's also transition in agriculture, water, and all of the resources that are going to become more unpredictable and more scarce going forward. And equity in access to those resources is critical for socioeconomic development and reducing poverty. If we're going to have fewer resources, we need to have a means of ensuring that everybody has access to them. And if we don't do that, then what you can do is you can create a spiral of inequality and poverty, which then undermines the ability of the economy to develop in the long run.
Sure. And related to that, your research has focused a lot on the affordability of basic services. Could you speak a bit to the link between affordability and dignity?
So when we think about access, we have to think beyond just physical access. Often when we talk about access to electricity or access to water, we think about electrification, connecting households to the grid or connecting households to a formal water system. But that's not enough to actually be able to use enough of the services to be able to live a dignified life and to be able to engage in productive activity. So I think it's very important to remember that when we look at foundational documents like the Reconstruction and Development Program and the National Development Plan, that access to resources like water and electricity were meant to achieve two goals. First of all, they were meant to facilitate a basic standard of living, which unfortunately we've never defined in this country. The National Development Plan says that we're going to make sure that everybody has a minimum standard of living, but we've never defined what that is. But irrespective of that, it's quite clear that the intention is that people have got access to enough services to be able to live that minimum standard of living, but then also very importantly, that people have got access to enough services to be able to engage in productive activities, whether that's water for growing food at home or whether it's electricity for a small business. So it doesn't help if you're just connected to a service. You have to be able to actually use enough of the service to achieve those goals. And all of the services have to be paid for. We don't have a system where people can access endless amounts of services for free. So affordability is actually the most important barrier towards people being able to access enough services.
Sure. And I think part of your research, or the research that you built on, was to show that households often sacrifice or forgo other household needs in order to purchase things like electricity and water. Could you speak a bit more to that?
Yes, so what we're creating really is a zero sum game. In fact, it's worse than a zero sum game. We're undermining our own development goals. So, the most important item that is sacrificed in households to pay, especially for electricity, is food. And the reason for that is because food expenditure is one of the few items that households actually have control over. They don't have control over how much rent they have to pay. They don't have control over how much taxi fare they have to pay. They don't have control over most of the expenses, but they can adjust their food budgets. So what is happening, and the research has shown that in multiple occasions, is that households are reducing the amount of money that they allocate to food in order to pay for electricity, and particularly because of the rise of prepaid electricity meters. It means that people can't defer their electricity purchases. Now, that is very important, the impact of reducing expenditure on food. South Africa, for a middle income country, actually has incredibly high food insecurity, child malnutrition, and food insecurity outcomes. So when households reduce food expenditure, they do two things. First of all, they purchase less food, so they're not eating enough calories. But almost more importantly, what they do is they cut out the more expensive, high-value protein items. So 28% of South African children under the age of 5 are classified as stunted. And the main reason for that is because of insufficient protein in their diets. And this has a big long-term impact on socioeconomic development. Children who are severely malnourished can't learn in school. There's a proven link between chronic childhood malnutrition and an increased propensity for violence and addiction in adults. So child malnutrition probably explains a hell of a lot of especially our domestic violence. Diabetes due to poor diet is now the leading cause of death of Black women in South Africa. So we're supposedly improving people's lives by giving them access to services, but because they can't afford to pay for them, they're taking money from their food budgets, and the end result is a deterioration in our development outcomes. And there's been some research that was done. People were asking, why have child malnutrition statistics not really improved as social grants have increased? And one of the main reasons for that is because of the competing claims on those social grants apart from food, and electricity is a big one of those.
Sure, I think that's so important to understand that these services and things like food and nutrition are all really connected at a very basic level. And I think part of that is this idea that you put forward that the free basic service package only allows for survival, really. And there is this kind of idea of developmental access instead. Give us a bit more information about what developmental access would be. And I know in the research you also worked out or figured out the kind of level that basic service packages should be at in order to allow for developmental access.
So the differentiation between survival level of access and developmental level of access is based on this understanding that access to services is meant to facilitate a particular outcome. It's not just a tick the box, people are connected to the grid, or it shouldn't be. That's what it's turned out to be in many cases. But the reason why we want everyone to have access to services is so that they can improve their standard of living and so that they can engage in productive activity, especially using electricity. So if we want access to services to deliver that developmental benefit, then we need to think about the amount of services that people can actually access. And there's a certain minimum level of services that are required in order for people to be able to sustainably improve their lives. And if we want to realize the developmental benefits of access to services, we have to make sure that when we talk about universal access to services, that we're talking about everybody having access to a certain minimum amount of services. And we've calculated that the developmental level of access to electricity for a household is 350 kilowatt hours per month. Various other people have estimated that as low as 200, so between 200 and 350 kilowatt hours of electricity every month. And for a household of 4, we've said 13 kiloliters of water a month. More if the household wants to engage in more intensive food production. But those would be the two minimums that we would look at: 350 kilowatt hours of electricity for a household and 13,000 liters of water a month. So the way in which South Africa addresses affordability of services is through a combination of free services and then a stepped tariff. So what that means is that the goal of affordability is included in all main policy papers. The local government white paper says services must be affordable. Other policy documents say services must be affordable. And the approach has been to say, all right, so what we're going to do is that for low-income households, we're going to give some free services. And then for the other services, they're going to pay on what is called an inclining block tariff, which means the less you use, the less you pay. So the tariff steps up. You pay more per kilowatt hours of electricity the more you use, and you pay more for water the more you use. Now, in theory, that is actually a very viable idea, but the actual benefit that accrues to poor households depends very much on where you draw the line. What portion of the services that households need are actually free, and what portion do they have to pay for? So what we have at the moment is, if we say the developmental level of access for households for electricity is 350 kilowatt hours per month, the free basic electricity is only 50 kilowatt hours per month, which means households must pay for the balance. The free basic water is 6 kiloliters of water, households need 13. So it's the ability of households to pay for that balance of services that we need to consider. But we also need to consider the fact that the free basic services policies are very poorly implemented, and that the majority of households that should benefit from them don't get them. So we have no problem with the principle of free services and then inclining block tariffs, but it's very much dependent on making sure that the level of free services is high enough to ensure that every household can access the developmental level of services.
Sure, so it's really about pulling up the ceiling a little bit so that everyone can access at a developmental level at least without having to pay for services immediately.
Yes. So then the question of affordability is to say, can households actually afford to pay for those extra services they've currently got to pay for over the free basic services? And rather disturbingly, no one's ever actually done that calculation. No one in the state has actually said, this is affordable for a household that looks like this. People say services must be affordable, but we don't have any concrete affordability standards. So if a household's got to pay for 300 kilowatt hours of electricity every month over and above the 50 kilowatt hours, what is affordable for that household? So that's what we went and did in the study. We went and did a relative affordability study, which means that we first deducted from the household income the cost of a basic basket of food, on the basis that households should be prioritizing food expenditure, on the basis that all of our development goals from Section 27 of the Constitution through to the National Development Plan also want households to prioritize basic food expenditure. And then we calculated the cost of electricity and water, and then we determined that actually the 40% of the population that lives below the lower bound poverty line, which is roughly equivalent to a household that is earning at or below the minimum wage, actually cannot afford to pay anything for the developmental level of services without compromising food expenditure.
Sure, and this is really striking because I think it really pokes a hole in the idea that services should be paid for by everyone who's using them in the step tariff way that you outline. Let's talk a bit about policy then. Speak a bit about the kind of policy failures that you've seen in how affordability is handled. You said a little while ago that there's an implementation gap. So yeah, what are those kind of policy failures that impact affordability?
I think there are two sort of overarching policy failures, which is the way in which people conceptualize the issue of affordability. The first thing is that it very much seems to me that we have forgotten this idea that access to services has a purpose, and the purpose of that is to facilitate socioeconomic development. So we should think about universal access to services as an investment, as it were. We understand that everybody should have access to quality education because that is an investment in our future socioeconomic development. We understand that everybody should have access to minimum health care because that is an investment in future socioeconomic development. But we don't apply the same thinking to electricity and water. So what has happened very much is that access to electricity and water for poor households has become almost like a grudge delivery by the state, like it's charity, like it's something that we have to pay for people and we must try and make sure that they have as little as possible. So we've forgotten the purpose of access to services. We don't do that with education. We don't say, okay, well, sorry, if you're poor, then, stay literate, don't go to school because we're not paying for it. So we need to reframe how we think about electricity and water. So our goal should not be to make sure that poor households use as little as possible. Our goal should be to make sure that all of that investment in infrastructure, hundreds of billions of rands that we've made in connecting people to the grid, can actually be leveraged into socio-economic benefits. So that's the first failure, I think, is the way in which we conceptualize the role of access to services. We need to see it as an investment in the future, not some kind of charity that we don't want to hand out. The second thing is that nobody's ever really applied their mind to the concrete issues around affordability. We say services must be affordable, but then there's absolutely no conceptualization by policymakers of exactly what is affordable for households. There's absolutely no understanding of the sacrifices that households are making to pay for services. It makes me really angry when I hear people talk about the culture of non-payment for services and that we have to somehow, educate people, as it were, to pay for services. This shows that the state actually has no understanding of the struggles in people's lives to be able to pay for services. So I think those are the two main policy failures. Everything else flows from that.
Sure. And as you're saying, access to basic services like water and electricity is not a nice to have, right? I think that so much of the framing is that, as you say, it's doing people a favor rather than this is a really crucial part of how you build a society, and how you develop beyond what you currently have, which I think is probably what most people in government would say we're heading towards. But you spoke a bit earlier about prepaid meters and how that ensures that people have to purchase electricity, otherwise they don't have, and then they forego other household needs such as food. How do these kind of credit control measures, prepaid meters, disconnections, reinforce patterns of exclusion?
Yeah, essentially what you're doing is you're punishing people for being poor. That's exactly what it is. It's punishing poor people for being poor. And this just creates a vicious circle. The illegal connections damage infrastructure, which has to be paid for, which then adds to the cost of services. And there's just all these contradictory and counterproductive policy initiatives. So a huge goal of the state, and also that's been allocated tens and tens of billions of rands over the last 15 years, is to try and get people to start small businesses. It's impossible to do any kind of small business activity without access to reliable and affordable electricity. And yet, if we go and have a look at something like Gauteng's Township Development Bill, there's not one single sentence in it about improving access to affordable electricity. The data shows quite clearly that households that have got access to electricity are much more likely to start their own small business. Our own research shows that there are lots and lots of businesses that people want to engage in, but without access to electricity, they can't do that. So this kind of attitude of you can't have a service if you can't pay for it, and as you said, it's some kind of nice to have that you should be grateful for, while at the same time trying to support this small business enterprise. There's huge programs across the state trying to encourage people to produce more of their own food, but people don't have access to water. So, it really is completely counterproductive. We're supposed to have developmental local government. What is developmental about depriving people of access to the services they need to improve their lives, or forcing them to, reduce their basic nutrition intake to be able to pay the state for services?
Tracy Ledger reminds us that affordability is not a side issue. It is the measure of justice itself. When basic services cost more than people can pay, the systems meant to guarantee dignity end up reinforcing inequality. But the effects of that failure reach far beyond the household. Across South Africa, unreliable and unaffordable services disrupt daily life, from small enterprises to informal work, from care responsibilities to community life. In part 2, we conclude this conversation with Dr. Tracy Ledger. We look at how South Africa's revenue-driven service model turns basic rights into commodities, why poorer households bear the brunt of outages and infrastructure failure, and what policy change would actually make developmental access possible. I'm Tasneem Essop, and you've been listening to Just Access, The Real Transition, a podcast from PARI, the Public Affairs Research Institute. To learn more about PARI and their research, visit pari.org.za. If you found this episode useful, please like, follow, or subscribe, and share it with others, and keep listening.